Hi everybody, welcome to Colitis, Ulcerative Colitis, and Crohn's Disease. Gurgles Gas Be Gone by myself, Dr. Michael Partula. And this is part of our ongoing series to inform you of provide you with the knowledge, okay, to be able to make informed decisions about your healthcare, and to basically inform you of various alternatives that can be that typically we'll recommend to address different factors. And all this fits into our long-term health strategy, which is to isolate factors that cause disease and in doing so get results. Some of these factors I'm going to talk about over the course of this lecture really you might not have heard of, so don't be surprised with some of the content. Now, Crohn's and ulcerative colitis are characterized by chronic inflammation of long-standing at various sites in the gastrointestinal tract. Okay. Colitis is inflammation of the GI tract, and it's not as severe as Crohn's or ulcerative colitis. Symptoms for Crohn's disease, okay, intermittent bouts of diarrhea, low-grade fever, anorexia, weight loss, flatulence, malaise, right lower quadrant pain and tenderness. Signs of an abdominal mass can be there as well. Okay, and X-ray is typically showing abnormality of the terminal ileum. Okay, the terminal ileum is the last part of the small intestine. So in the small intestine, you have three sections. One is called the duodenum. Okay, and then we have the jejunum. Then we have the ileum, and then the ileum basically is the last part of the small intestine before it actually dumps into the large intestine. So Crohn's disease is also commonly referred to, at least used to be referred to, as lead pipe syndrome because the actual intestines look like a lead pipe. Now, ulcerative colitis symptoms, okay, bloody diarrhea with lower abdominal cramps, weight loss, fever, perianal irritation, fissures, hemorrhoids, fistulas and abscesses, and diagnosis is confirmed by X-ray, sigmoidoscopy, and colonoscopy. Okay, are the basically typically the diagnosis, and also doing a tissue biopsy. Okay. I have a special interest in ulcerative colitis simply because I have had that diagnosis myself, and recently went back for my follow-up colonoscopy, and it's all gone. There's basically no residuals of it. They did a number of tissue biopsies and showed that there was no colitis, no ulcerative colitis. And I had ulcerative colitis quite severely a number of years ago, where okay, typically you're 20 trips to the bathroom, okay, lots of blood and mucus, okay, bloating, fatigue, okay, and basically it was a multitude of factors presenting themselves as we'll go along a little further, okay. Now, population statistics, incidence of Crohn's is 2 in 100,000. Ulcerative colitis is 6 to 8 per 100,000. And prevalence is 20 to 40 out of 100,000, okay, and 70 to 150 out of 100,000. Okay. Now, it's worse between 15 and 35-year-olds, and females are slightly more affected. And Caucasians are typically 2 to 5 times more affected than blacks. Okay. I know we're not, it's not appropriate to basically sometimes share this information, but it is interesting, and we'll find out else there is some reasons to suggest reasons why as to the difference here between Caucasians and blacks. Now, etiology, okay, is very similar for both Crohn's and ulcerative colitis. However, modern medicine considers the etiology of either as unknown. They do not, okay, like to use the word idiopathic. Okay. Idiopathic means basically disease of unknown origin. Okay, idio is short for idiot. Okay, so that's why they don't like to use the word idiopathic. Okay, so historically, going back in time, basically going back to the Middle Ages, pre science, before science became established, there was generally in Europe, there was the governing forces of the church and the royalty, and then there was the peasant class. Okay, so when science came along, science basically said they wanted to get a get their foot in the door by creating a new class, which was a class of scientists. So they basically followed the church as a role model. And at that point in the church in Europe, all the sermons were typically in Latin, okay, which nobody really understood except for the educated class. And so science followed that lead and made it so that they created a new class in society, which was the scientific class, and everything was in Latin, even though there was nobody who spoke Latin actually in that day and age. But Latin was taught and learned by the educated, okay, masses. So the educated masses, which weren't that many actually. So what they did there is they created a whole new class and tried to take medicine out of the terms out of the use of the common man. So the common man really wasn't able to converse with somebody of the scientific class. And that's what we have here with words like idiopathic and a lot of the medical terms that you hear or see, and a lot of them are actually made up, which is quite interesting to note. So, now, question for etiology: is it a pharmaceutical conflict of interest? Okay. And the reason why we suggest that is because there's a lot of medications, okay, that basically address the symptoms and typically don't address the cause. So basically, when you're taking the medication, you're symptom-free. Okay. Unfortunately, this doesn't rectify the situation. Okay. However, you basically are symptom-free, but you're reliant upon the medication to do that. So there is a conflict of interest to be able to not search for an actual solution. A good example of pharmaceutical conflict of interest basically was with a lot of stomach problems. Okay. Back in the 1950s, they diagnosed H. pylori as a bacteria causing stomach ulcers. However, because of the use of all sorts of different medications for stomach and gastrointestinal irritation, they really didn't address it until about 15 years ago. And then they said, whoa, look at this great discovery we had. Meanwhile, they knew back in the 50s that basically microbial cause of stomach ulcers was there. And was that a pharmaceutical conflict of interest? Okay, possibly, because all those medications were being taken by a lot of people, and hence, since the application of antibiotics, a lot of those sales of those other gastrointestinal soothing agents have basically dropped off immensely. Or it could be that their patents ran out. So there's lots of reasons for that. Now, it can also be bad science. Okay, now bad science basically maybe they're looking in the wrong direction. Okay, and that's something we're going to talk about here. Okay, simply because we're going to talk about a few factors that modern medicine really doesn't like to address. Okay, for some strange reason. Now, etiology or cause. Okay, basically genetics, infection, antibiotics, chemicals, psychosomatics, vascular, trauma, dietary, heavy metals, immunological abnormalities. Okay, and there's more, but we're going to go through some of these as possible etiologies. Now, here we have the genetic risk. Okay. And here we have genetic risk in Caucasians, it's about 10, okay, compared to in blacks, it's about 2.5, or 3, actually. So 2 to 5 times greater in Caucasians than in blacks, okay. In multiple family members in 15 to 40% of cases. And there's no real genetic marker. Dietary factors: Western diet diseases does not occur in primitive diets, so it's strictly associated with Western diets. Okay. And Western diets generally have an excess of refined sugars, less fruit, veggies, and fiber, and an excess total fat and dairy products, and possibly food allergies too, by a combination of all the above. Now, just to give you a heads up, in the next month or two, we're going to be releasing, and right now it's April of 2013. So in the next month or two, we're going to be releasing our book, the My Health Navigator. And My Health Navigator basically will explain all these things in thorough detail with all the research behind them as to why all these different factors are appropriate and why they're important. So if you're interested in more information, ultimately when we release the book, feel free to contact us and look for a copy of the book, and hopefully in about 3 or 4 months we'll have it listed on Amazon. So that's one of our goals. So allergies, okay, definitely increase the risk. And all these, so elimination diets and elimination allergies technique treatments have proven to be very successful. Like I said, I had ulcerative colitis, and for me the biggest effect was actually the eliminate allergies technique and fasting, okay, as well as going on various elimination diets, and applying a lot of the information that we are covering in this show talk. Now, immunological abnormalities are not causal in and of themselves, but are secondary manifestations of other causal factors, such as chemicals, heavy metals. Okay. Heavy metals, for instance, they know that heavy metals, when they attach to proteins, self-proteins, like your cells, basically it makes them antigenic, so the immune system will actually attack those cells, thinking they're foreign. And the same thing can happen with chemicals too. So, now dietary habits, we talked a little bit about, and then food allergy too. Okay, and we'll talk more on the different type of food allergy, and there's also food sensitivities. And trauma can induce some of that as well. And interestingly enough, stealth microorganisms. So stealth microorganisms are basically microorganisms that are really good at hiding from the immune system. Hence, they are stealthy. Now, infection causes. Okay, we have stealth microorganisms such as rotavirus, Epstein-Barr virus, cytomegalovirus, mycoplasma, intestinal cytopathic virus, chlamydia, pseudomonas, enteric anaerobes, Yersinia, enterocolitica, and others. Okay. Now the challenges with some of these things is they're really hard to basically diagnose. Okay. The reason being is you have to catch the microorganism in an infected cell. Okay. And it's really hard to get an actual sample of an infected cell. Okay. So infection, as far as diagnosing it as a cause, is really hard to do. But they have discovered all these microorganisms in significant concentrations in individuals who have ulcerative colitis Crohn's. Now, the microorganisms can attack cells directly or precipitate immune responses by their presence. So sometimes what happens with these stealth microorganisms is the immune system knows there's a bug there, and knowing there's a bug there, but these microorganisms are actually really good at hiding from the immune system, so the immune system kind of just says, okay, we know it's around here, so let's just kind of attack the whole area. Okay, so, and that's where they try to basically blast the whole area, which just contributes towards mucus, inflammation, okay, frequent stools, etc., etc. And you'll also hear of a lot of people actually in their history, they'll say, yeah, gee, ever since I went down to Cuba, Dominican, Mexico, okay, I had developed ulcerative colitis or Crohn's, okay, and that just confirms more of a infection. Now, psychosomatic factors, certainly stress can contribute to this. Okay, so when you're under stress, your adrenals pump out adrenaline to pump you up and keep you going. They also pump out cortisol, which knocks out your immune system. So when you get exposed to a microorganism, that microorganism can basically replicate in your system unchecked, because your brain is essentially telling your body, no, you can't go after this microorganism because what you're going through mentally, emotionally is way more important than this infection. And then the infection can get the upper hand, and then only when it's really the infection has gotten consistently bigger, and it becomes a bigger threat to your survival than the actual stress, then your immune system responds. Or you either get burned out and then your immune system responds. So stress can be a factor, and what stress also does is the effects of adrenaline. Okay, so you have your sympathetic nervous system, which is your adrenaline response, and you have your parasympathetic nervous system. So your sympathetic nervous system is fight or flight. Okay, fight, flight, or freeze. And so what happens when you're running off of adrenaline, the adrenaline affects your body by shunting blood away from your organs of digestion to your periphery. So getting ready to fight, flight, okay, or freeze. So when you do this enough times, yes, it can have an effect, but generally it's really as a factor, it will contribute and exacerbate things, but generally by itself, it is usually not considered to be a causal factor in and of itself, but it can certainly precipitate other factors. So, vascular disease within intestinal arteries is usually secondary to other causes or manifestations of systemic vascular disease. Okay, and other factors can be basically, as we'll get to shortly, trauma. Okay. Can be contributing to causing vascular damage. Okay, infection can contribute to that as well. Okay, scar tissue from inflammation can contribute to that. But generally, if there's a vascular component, typically it'll show up in a heart condition first, or it'll show up in peripheral vascular disease first. Rarely does it show up in and of itself. Okay, in the intestines. It's usually a combination of factors and combination. Now, trauma, okay, can precipitate other factors to become more active, such as infection, etc., but typically is not recognized as a factor unto itself in regards to colitis or Crohn's. Now, trauma can create a lot of inflammation, true, and can create a tissue misalignment, okay, and damage to the tissue. But generally what happens then is, in and of itself, yeah, there's damaged tissue, but if there's a healthy environment with that damaged tissue, in most cases it won't create a problem. Or if you put a stealth microorganism in there, okay, you put a lot of inflammatory foods, okay, don't drink enough water, among other things, then guess what? That can make it so that trauma certainly can be a aggravating factor. For certainly, there's lots of chemicals, okay, that can affect this. Could be food additives, okay, could be pesticides, herbicides, okay? And there are many chemicals that are added to in our Western diets, okay. Elimination diets have proven successful with the elimination of food additives, okay, and other chemicals found in food and in the environment, such as we talked about, pesticides and herbicides, okay, have well documented GI toxicity effects. So there is quite a few. And GMOs, okay, so genetically modified organics, they're called. That's why they say GMOs. And we've yet to see what this mass experiment brings us, okay. Do we know what the long-term implications are in our bodies? Okay, certainly not. It hasn't been long enough. So well, we'll have to see, monitor that basically effect as time goes on. Antibiotics. Prior to 1950s, Crohn's was very much genetically clustered. Now, with the use of antibiotics in the 1950s, the climb in irritable bowel disease has mirrored the climb in antibiotic usage, which is pretty interesting. So, now, antibiotic usage since the 1950s is not just for us as humans, but it's also gone up with the animals that we consume. Okay, so for instance, red meat. Okay, so cows, pigs. Okay, basically all your animals, domesticated animals. Okay, bred for consumption essentially. Chicken, okay, they're all exposed to antibiotics, okay, and antibiotics is typically added to their feed, okay, and what this does is it actually can precipitate more microbial resistance, okay. Now, interestingly enough, microbial resistance doesn't happen with, actually at first doesn't happen with the bad bugs, okay. It actually happens with the good bugs. So what happens with the good bugs is they get exposed to an antibiotic, okay, and of course the good bugs are, what they're trying to do is they're just trying to survive the assault that they're dealing with. And what they found on electron microscopy, okay, and they basically highly magnified microscopes, is they've been able to actually see that these healthy microorganisms in the intestines actually figure out the code, genetic code, to break the antibiotic, okay. And what they do is they actually put this code in their cell wall, and then a pathological bacteria will brush up against them, grab that DNA, and now it's antibiotic resistant. So pretty interesting. Now, there's also the burden put on our intestines because of antibiotics. Okay, think of antibiotics basically as being synthetic mold. Okay, that's essentially what they are. So synthetic mold, and a lot of people actually have mold sensitivities. So especially if you live in high humidity environments, you'll know all about mold. If you live in, say, the interior of BC, Alberta, Saskatchewan, okay, and the majority of Manitoba, it won't be an issue. But if you live in Ontario, Quebec, okay, and the Maritimes in Canada, and into the States and the Eastern Seaboard, you'll definitely know what humidity is all about, and you'll have a definite understanding of mold and how it can impact the body. So heavy metals. These are, as well as other heavy metals, can precipitate severe GI inflammation and bleeding. So just being exposed to these things in significant quantities they directly, all these can actually cause those symptoms, GI inflammation and bleeding. Now, there's it's called the Agency for Toxic Registry down in the States, and what they do is they basically take all the chemicals that are being produced, and what they do is they assess them every few years, and they rate them from 1 to 250, even though there's hundreds more that are included in this survey. And they rate them for their effects on human health. Okay, and typically, okay, arsenic, okay, lead, and mercury are always within the top 3. So sometimes they rotate positions, but for the last number of years, arsenic has been number 1, lead has been number 2, and mercury has been number 3, and cadmium has been number 7. Okay, out of all the substances that are considered toxic, that's how they rate them as far as their potential to do damage to humans. Okay, now unfortunately, what happens here is we do get exposed to these things. Arsenic is found in a lot of pesticides, okay? In particular, pesticides for ants, termites, okay? And arsenic can accumulate in your tissues. And arsenic, interestingly enough, up until 2004, I think 3 or 4, arsenic was used in pressure-treated wood, okay? And since that time, they've actually taken the arsenic out and they've put in nothing but copper and significant amounts of copper. And what they found was that ladies who were walking barefoot, okay, across a pressure-treated wood deck, okay, at certain times in their pregnancy, stood at higher risk to be able to have complications, genetic complications, okay, with their babies because of the damage created by arsenic absorbed through their feet. So arsenic is really, really quite toxic, and if toxicity symptoms of arsenic definitely include GI inflammation and bleeding. Now the next one's lead, okay, and lead basically is found in paints, okay, old paints, okay, found a lot of plumbing fixtures, okay, and even in some of the houses, basically any house made before 1991, that's something you need to be concerned with. And anybody born before 1991 is actually full of lead. Now, whether you like it or not, okay, if you're born before 1991, you're full of lead. Now, the half-life of lead in the human body is 30 years. Now, it hasn't even been 30 years yet since 1991, okay? So it's just been, 22 years. And what the half-life means is that's the time that it takes for you to eliminate half the amount of lead that you were exposed to, okay? So we haven't even hit the 30-year mark. So, and I'm sure we've all been exposed to more lead as time goes on. And lead can be found in all sorts of different consumption products, and actually, surprisingly, quite a bit in lipstick. So, next one we have is mercury. Okay, and mercury is found as a pesticide as well. There are mercury-based pesticides. Okay, it's also found in your teeth. Okay, for those people who have silver, they call them silver amalgam. Okay, fillings. Now, silver amalgam fillings are actually mercury and silver. Okay. And they're 50% mercury by weight, and this leaches into your system, and if you have a lot of them, that can be a major factor for ulcerative colitis and Crohn's. Now there's other sources of mercury, which is called thimerosal in vaccines. There's also mercury from fish, okay, that these are things that we can be exposed to. So mercury is one. Cadmium, okay, cadmium can be another factor, and cadmium typically is basically you can get it from cigarette smoke, okay. Also with cadmium, in cigarette smoke, arsenic is in there as well. And cadmium is typically used for coloring agents. So a lot of your strong colors, you call them cadmium yellow, cadmium orange, cadmium red, and those are all found in those brilliant colors of paints. So treatment, dietary changes. Okay, number one, increase fiber. Okay, soft fiber and then hard fiber. Now what we mean by that is soft fiber is basically really soft. So what happens with that is basically steamed and cooked vegetables, so that basically when you take your fork, you put your fork on it, it actually passes right through. So the actual steaming process or boiling process has broken up the structure so that it's really super easy to digest. Okay. Now, other examples of soft fiber would be if you get something like Boston red leaf lettuce. Okay. Basically, the really soft lettuce where you actually put your finger on it and you rub your fingers back and forth and it dissolves. That's the type of lettuce that's really soft. Now, hard lettuce would be like iceberg lettuce, okay, or the spines of romaine lettuce. That would be an example. Celery would be hard. Carrot would be hard, okay, unless you really cook that well. Those would be all ideas of hard fiber. Okay. Now, soft fiber can also be psyllium, okay, and even flaxseed can fall into that category too. Now, fish, okay, increasing fish, but generally not more than twice a week, and also complex carbohydrates, okay. So, which complex carbohydrates generally, by definition, have more fiber in them, okay, and also they're lower in sugar, and sugar generally increases inflammatory responses throughout the body. Now, you want to also look at decreasing meat. Okay, meat by itself is generally inflammatory. Okay, however, what you might find that some individuals who have a fair bit of inflammation and they're having a hard time with absorption issues, really meat might be a good source of nutrients for them. But if they are going to have meat, if they have a a nice thick juicy steak, okay, not a good idea, simply because your digestive tract has to work really hard to break that down. Something where the meat is typically pulverized, like hamburger, okay, especially extra lean and preferably organic, where so the fat can drip off of it as you cook it. So you want to grill it so the fat comes off, because that'll reduce the toxins, okay, and also reduce the inflammatory fats. But some individuals might find that it has to be broken down that way into hamburger form, so it's easy to digest and get the nutrients, okay. Now, dairy, generally, there's a whole bunch of problems with dairy. One is lactose, okay, and one is casein, as an example. So casein is the protein in dairy, and when they do the pasteurization process in dairy, it actually changes the casein molecule, so it turns it into a gastrointestinal irritant. And the other factor with dairy is lactose intolerance. Now, if you're from Northern European descent, generally it's about 3 to 6% of the population is lactose intolerant. Now, if you're of Southeast Asian descent, okay, guess what? It's 100%. Okay, of people are intolerant. Okay, if you go around the Mediterranean, generally it's about 70% of people are lactose intolerant. So there's a whole chart that we have in our book, My Health Navigator, okay, which basically addresses all these different background information as to why it's such an irritant. Now, sugar, as I mentioned earlier, what sugar does is increase inflammation, but not only does it do that, it basically feeds microorganisms, okay, and it knocks out your immune system, so not a good substance. Now, corn, okay, corn simply because of the fiber in it, okay, as well as corn is quite sweet, actually, okay. And then wheat, the tough part with wheat is basically there's a number of irritants in wheat, and gluten being one of them, okay, and a lot of people are actually wheat intolerant, and so generally, ideally, we'd like to suggest you remove all these things for a while. And then refined carbohydrates, so your corn chips and your other chips, etc. Okay, anything that's really processed, and of course any known allergens is really important. Now, minerals. Hey, if the disease is severe enough and malnutrition is evident, we typically recommend intravenous vitamins and minerals. Okay, simply because if your digestive tract is so compromised and you get so much inflammation, you're not absorbing anything. Okay, so we might have to deliver those nutrients. We might have to bypass your digestive tract and actually deliver them right into your bloodstream. So nutrients that are commonly needed is magnesium, okay, zinc, okay, iron, okay, calcium. Now, generally iron intravenously, we don't really give it, okay, but we definitely do give the other nutrients, other minerals intravenously. Iron, the best way actually is to tell you basically is to consume red meat. Okay, that's by far the best way. Certainly not liver. Okay, there's no healthy livers on the planet anymore. Red meat is one way to do it, and we talked about hamburger already. That would be the best way, and especially cooked, extra lean, organic, cooked, so the fat drips off, so all the toxins leave. Now, other than that, there are different supplements like Floridix iron, okay, that can really help as well. But generally, most of your pharmaceutical irons are really hard on the digestive tract, will make you constipated, which will actually create more of a challenge for you. So, and potassium. So potassium is, we put that in IV bags, but it's readily available in most supplements. Now, vitamins, intravenous vitamins are also strongly recommended, and typically we mix the vitamins and the minerals together, okay? And we use vitamin A, C, D, E, and K. Now, generally, it's mostly vitamin C that we use, okay? Vitamin A, D, E, okay? And K, generally, these are fat soluble, so they're actually pretty easily absorbed. Other nutrients that are important would be vitamin B12, okay? However, unfortunately, with vitamin B12, it's absorbed very quickly, and unfortunately our kidneys clear it out quite quickly. What happens with colitis and Crohn's, there are villi on our intestines, and these are small cells that actually work in conjunction with microorganisms to make this nutrient. So generally, because of the damage to the area, a lot of people are deficient in vitamin B12. So we will add that to our IV bag as well, or give some people actually an intramuscular shot of it. And the same occurs with folic acid. Supplements quercetin. Quercetin is an amazing supplement. It actually prevents against bowel cancer and assists healing directly and indirectly. However, some people can't handle it that well. Okay, it does create some gastrointestinal irritation for some individuals. Now, quercetin actually does a number of other things too. It actually maintains the integrity of the blood vessels, and it also basically helps enzymes, decreases inflammation, and speeds the healing of the intestinal mucosa. Okay, and it also modulates intestinal mobility. but it also helps with the blood vessels. So if there's any hemorrhoids, it'll actually help supplement. Now, Western botanical medicines, okay, now this is a formula called Robert's formula, and this is commonly used for basically any type of gastrointestinal irritation, but irritable bowel, colitis, Crohn's, ulcerative colitis. So indigo helps address infections. Marshmallow is a demulcent, which means that it soothes irritated and inflamed mucous membranes. Echinacea stimulates lymphatic drainage. It also is antimicrobial. Okay, now you've probably heard about taking echinacea long term. It has some negative consequences. Yes, it does, but that doesn't. Those long-term consequences are based around its immune-stimulating capability. In this case, we aren't giving it for immune-stimulating capability. We're actually giving it as an antibacterial and lymphatic drainage ingredient. Okay, so taking it long term is actually okay because we're not interested in actually stimulating the immune system. We're actually trying to balance it out. Okay. Geranium is hemostatic. Now, some of the formula has been changed to I don't know what the status of this herb is right now. Okay. At various times, they've made this herb that it's unavailable. Okay. For some strange bureaucratic reason. Now, golden seal is an incredible herb. It's antibacterial. Unfortunately, we put it in a liquid herbal tincture. It actually affects the taste in a big way and doesn't make it taste very good. Phytolacca is a herb that heals ulcerations in the gastrointestinal tract. It also is an incredible lymph drainage remedy as well. And comfrey is anti-inflammatory. It assists in healing. Okay. And comfrey is one of those that at various times they've taken it off the market. Okay. And typically because people are consuming too much of it all at once. Now, slippery elm is a demulcent, much like marshmallow. It actually soothes irritated, inflamed mucous membranes. That's what a demulcent is. It just brings all down. Now, comprehensive treatments, and the one that I found most successful actually is eliminate allergy technique. So for myself, it was pretty interesting that going to get my original training in NAET, okay, through Dr. Nambujaprad in California when I did my training there. And then seeing the limitations of that, we've kind of tweaked it to add a number of things and make it a whole lot easier for our patients and to make it more effective. So we call it eliminate allergy technique. Okay, and this makes it so they can absorb nutrients. So one of the unique things I found out years ago was I had a number of ladies come to see me, and these ladies were all had osteoporosis. But the unique thing about these ladies was that when they went to consume their calcium, which they needed to treat their osteoporosis, they reacted violently to it. So they reacted to it with nausea, vomiting, diarrhea, headaches, migraines, fatigue, aches and pains. So it's like they actually had an allergy to it. So this was quite stymieing to me because I couldn't believe that people would actually have allergies or sensitivities to nutrients. And that's one of the things that I found out through this course. So I myself went through this treatment process and basically addressed my own nutrient allergies, and I had a lot of them. And now that I could absorb nutrients, my tissues could actually heal themselves. So, now the other thing that we found was microorganism elimination technique. Okay, this basically helps address those stealth microorganisms. Plus, we give actually herbs to help address those microorganisms as well. And my ulcerative colitis was good for quite a while, and then I went down to Cuba, okay, with my family, and unfortunately contracted a bug, and that made everything worse for a while until I actually found the right supplements to get rid of that microorganism. Now, Western botanical medicines prescribed on an individual basis. We talked about some of the other ones earlier, okay, on the previous slide. Now, other microorganisms or other Western botanicals we might mix into a tincture would be possibly mood elevating and nervous system relaxing, okay. Herbs, okay, and these are basically if stress is a pretty big factor. We also might look at supporting the liver and kidneys. Again, if there's excessive exposure to chemicals, liver and kidneys would need to be supported. And homeopathics typically are prescribed symptomatically and, if applicable, constitutionally. And homeopathy is the second largest system of medicine in the world. And it has an interesting history in North America. There used to be over 100 homeopathic hospitals in North America, one with over 2,000 beds. Okay, and there used to be over 20 homeopathic medical colleges, including Boston University, University of Michigan, University of Iowa, to name a few. And homeopathy fell into disrepute in North America simply because it was legislated out by pharmaceutical interests. Okay, reason being is you can't make money off of homeopathics simply because you can't patent them. So everything in pharmaceutical medicine is around patents. Okay. So next thing we talked about dietary changes, which we covered already. Okay, and then stress management, which is a process called heart math. Okay, which is an empowering process to be able to empower our patients to actually be able to take themselves through a simple technique, okay, to be able to bring themselves back into what's called coherence, which is relaxation. Now, ozone has actually been effective too. Rectally applied to stop the bleeding. Okay, ozone basically kills microorganisms, but it also is hemostatic, which means it can stop bleeding. Okay, so at first we apply a fairly high concentration in small dosages, and then as the bleeding stops, then we try to basically increase circulation. Okay, and we basically in increasing the circulation, we go with lower concentrations and actually increase the volume. Now, other things that we do, acidophilus and other intestinal microflora. And interestingly enough, if you look at the intestinal microflora capsules, it'll say so many billions in there. Not millions, billions. That's a lot of microorganisms. So what we're trying to do with those is basically repopulate the intestines. So those will help. And IV vitamins and minerals for very chronic cases of long-standing, where the basically absorption and nutrition status is in question. Of the individual, and they might not have the necessary materials for the body to heal themselves. And colonics, okay, selectively applied. Okay, so what colonics are, basically it helps detoxify the bowel by removing fecal matter, toxic bile, and the recycling of toxins. Okay, one of the things we might do is include that with a fast as people get up their strength. Okay, and they get to a level of healing. And if, in particular, if there is an issue of fat-soluble toxins, one of our goals with fasting is to remove those fat-soluble toxins. And typically colonics is part of the treatment strategy with fasting. And then ozone with colonics. Okay, so colonics basically being able to clean out the actual negative debris, and then with the ozone being able to stimulate circulation and also stop bleeding. Now, here we have narrow definition of allergy, okay, and the broad definition of allergy. Narrow definition: must initiate an immune response. Okay, tested by intradermal, okay, so into the skin, okay, patch, scratch, and blood tests such as RAS and ELISA. Typically, this narrow definition involves hives and anaphylactic reaction. Now, that's actually really good because it determines if there's an immune response. However, okay, a lot of people don't have an immune response. Okay, what they'll do is they'll basically consume something and they will fall into the broad definition of allergy. And anything that basically causes an abnormal physiological response, such as eating a food and getting diarrhea. Okay, so some people come in, they go, oh yeah, I got tested, skin tested for, and patch tested for my allergies, and I don't have any. And that's because they're strictly looking at the narrow definition of allergy. And sure enough, as we get them to do their diet diary, it shows that every time they eat wheat, okay, guess what? They're running to the bathroom. Okay. And they might get an exacerbation of their mucus in their blood. So that's all part and parcel of the broad definition of allergy. Okay, so broad definition of allergy is more of a functional diagnosis. Functional means you need a tune-up, okay, and get rid of the irritant. And the narrow definition of allergy basically is there's tissue damage and there's an involved immune response. And that immune response can be propagated by, like we talked about before, heavy metals, chemicals, stealth microorganisms, etc. Now, eliminate allergy technique. With EAT, we have documented success of getting rid of anaphylactic reactions to many foods, okay, in particular peanuts, eggs, and shellfish, okay, and many others. People who need EAT, okay, people with allergies to foods, people with nutritional absorption issues, people who have symptoms after eating certain foods, yet the reaction does not include an immune response. So that's based upon the broad definition of allergy, okay. So eliminate allergy technique, especially for any gastrointestinal illnesses, this is amazing. So it's a really effective technique. Now, for some individuals, what we might have to do, especially in difficult cases, we've treated them with EAT, they've had some success, and then we've had to detoxify them of other things, and that could have been heavy metals, okay, or that could have been detoxifying chemicals, okay, or having to address a stealth microorganism, and then we might have to redo the EAT, okay, simply because there's that cross-reactivity to different nutrients and foods based upon the presence of microorganisms, heavy metals, and chemicals. So sometimes it's a more challenging issue to get results, but the majority of people actually do know significant changes just by doing the EATs. Okay, so. And EAT helps erase it all, and that's what we want.